But welcome to our community forum for Tuesday, October 17th, 2023. We're excited to be with you in the audience again today. We have a very exciting discussion planned for you with wonderful participants. Here at CDU, just in the past week, we celebrated Happy National Coming Out Day. I don't know whether this shows up, but we had a wonderful convening there, and we're going to follow that with a discussion today. Our topic is timely, and it's going to be LGBTQIA plus voices in the community. For those of you who are not familiar with that string of initials, it means lesbian, gay, bisexual, transgender, queer, intersex, and asexual voices. So it's a variety of people, a variety of perspectives, and our discussion will highlight the challenges faced by the LGBTQIA plus communities. More specifically, health disparities, the intersection of gender identity and ethnicity, the youth population, and advocacy groups. I'm looking forward to learning more, as I hope you are in the audience, from our discussion today. Our panel of experts each have their own perspective to contribute to this discussion. We're honored to have from the TransLatin Coalition, Alexandra, pronounce it for me, Alexandra.
Magallon.
Okay, thank you very much for that. And we have Juan Ruiz, and Juan is, where are you from, Juan?
I'm currently a second-year doctoral student in public health at UC Irvine.
Okay, and we have Dr. David Carlisle, who is the president of CDU, and our very own Cynthia Davis, who's assistant professor of urban public health at CDU and co-director of the CDU Kedron Street Medicine Program. Dr. Davis is the person who first introduced me to HIV issues many years ago when I was at THE Clinic, and she's been my tutor here at CDU ever since, trying to keep me abreast of developments and what was needed in the community for advocacy and partnership. She's a board member of the AIDS Healthcare Foundation since 1988, and we welcome you, Cynthia, to this discussion.
Thank you.
Carlos had just said that he's a second-year doctoral student. Go ahead, Carlos. That's kind of tough in public health at UC Irvine, a real easy school, right? His research focuses on the structural determinants of health injustices among minoritized populations, and Latinx marginalized communities. Welcome to this discussion. Rounding out our population, our panel is David Carlisle. And I didn't talk about Alexandra. Alexandra, can you introduce yourself since you're substituting for the director of your program? Can you just say a word about who you are?
Yes, of course. So my name is Alexandra Magallon. I am the manager of programs and services here at the TransLatin Coalition. I am an intersex identified person, so I use my name as pronouns, and I am excited to be here today.
We're very glad to have you. Thank you. And then David Carlisle is joining our conversation. He is the president of CDU, board certified internal medicine specialist, and served as director of the Office of Statewide Health Planning and Development in California for 11 years under 3 different governors. So he's been around the block a few times. Our attendees can ask their questions in the chat or tweet them with the hashtag quote CDU Community Forum. Now, let's get started. Professor Davis, as co-director of CDU Kedron Street Medicine Project, Could you tell us about the project's goals and its impact on the LGBTQIA plus community in Los Angeles?
Sure, Sylvia. So the CDU Kedron Street Medicine Program was initiated in 2020 as a direct result of the COVID-19 pandemic with funding from the Bloomberg Foundation and CVS Health. We were able to mobilize to provide free COVID-19 screening services and then vaccines when they became available in the fall of 2020, primarily targeting medically underserved and other high-risk vulnerable populations in South LA, as well as other regions of LA County, who had low vaccine uptake at the time. We also responded to the monkeypox epidemic by making available monkeypox vaccines to the most at-risk populations in LA County at the time, which included gay and bisexual men of color, focusing our outreach in South LA. During this time frame, we partnered with Minority AIDS Project, which is the oldest LGBTQAI plus minority organization in LA County, established in the early 80s.
So who brought the van that you rode around town in?
Well, we have a couple of vans. We have our original van, which is the Mohawk van, which was purchased back in 1991 with funding from the Magic Johnson Foundation, Burroughs Welcome, and LA County Department of Health Services. But in 2020, with funding that we received from Bloomberg, we were able to get a brand new Winnebago van that has been retrofitted to provide primary healthcare services in the community. And additionally, 2 Ford cargo vans.
Okay. Oh, well, it was such an innovation to have mobile healthcare delivery in our communities in South LA. It was just very, very welcome. Let's see. Miss Salcedo? No. Miss Mayo, pronounce it for me.
Magallon.
Magallon. I'm from Washington, D.C. We don't speak Spanish at all in Washington. At least my community didn't, so please forgive me. May I just refer to you as Alexandra so I don't butcher?
Yes, of course.
All right, thank you. You've developed the Center for Violence Prevention and Transgender Wellness. Can you tell us more about this initiative and how it's made an impact on transgender communities in LA?
Yes, of course. So how the initiative has created impact for the community is that well, the TransLatin Coalition is made up of a two-prong approach. One is a risk provision aspect, and another a policy aspect, which dives in deep on the lack of services in LA County for the TGI community. So the policy aspect of this initiative is to make sure that, I mean, there is no policies in place for TGI people. So what the organization is set to do is to create these policies that are here for the betterment of the community, if you will. So since its inception, that is what has been led, and what Bambi leads with, is to make sure that we're leading with policy and creating the change that our community needs to be able to provide the services that are so desperately needed within the community.
Can you give me an example of a policy initiative that you've helped with?
Yes, of course. So just most recently, the Board of Supervisors voted to create a TGI motion, the Transgender, Gender Nonconforming Intersex motion, which addressed the needs of accessibility or not having services. So what we did here at the organization is we brought up the issue that there is lack of data being collected for community. There's lack of services, and so the main thing that we would always get asked is where are the numbers? Where in paper does it say that TGI people are experiencing this hardship? And as the leader of the policy department at that time, we got tired of being told, where is the data for LA County? So instead, what we did is we asked the Board of Supervisors to get on the same page, because we as an organization were providing services throughout LA County, not only in one district or in one area, but throughout the entire LA County, and also reaching counties like Ventura or reaching counties like Orange. So we're creating the service for TGI people, not only in LA County, but around counties that are in LA County. So we were providing services to all the districts. So what this motion did is to really highlight the need of data collection across the services that are provided in LA County, to be able to count TGI people, so that when things like COVID, for example, happened, that we did have data or information that was driven by data in the numbers of the population that was affecting, specifically TGI, when our community is so oppressed and marginalized, and not being able to be counted. So that was what one of the initiatives did. And now what that's doing, that policy component, is it's now highlighting the need for TGI people. So in the future, it's going to be able to fund services like in departments of mental health and departments of social services and all of these very important things across LA County that are needed. So that is how a policy component and a health services component both come together and both assist the community in developing the services that are needed for the community.
Was it difficult to get support at the board?
What was difficult was having everyone on the same page, because not everyone thought it was something that was needed within their district, but really highlighting how we have clients in District 1, District 2, District 3, District 4, and so on, so that the board members can really see how the Metro LA area is really being utilized by the entire county as a place for service provision when it comes to TGI people, and the effects and the things and hoops that clients have to go through, coming from, for example, Santa Clarita all the way down to Metro LA area. We know that for a person to travel, just in car alone, it'll easily be a good 2-hour drive,
Right.
let alone when they're utilizing public transportation to access these services. So that was really what we needed to do, is to really show the Board of Supervisors how this actually affects their community, or the communities in which they represent, to be able to get everyone on the same page. Once we did that, then it was just making sure that the motion highlighted the need, and that it really talked about the policy components that were needing to be changed, and why it was so important to create this motion at the Board of Supervisors.
So you became a partner in helping to educate them and identify
Exactly.
needs.
Yep.
Dr. Carlisle, your extensive work in health disparities has helped you see health challenges faced by this community. How does that fit into the broader framework today of health equity? Is it a struggle to get it into that larger framework, or are we proceeding well in making that happen?
Well, maybe thank you, Sylvia. Maybe the answer is kind of both. And in answering the question, I'll I'll just contextualize things a little bit. You know, as a healthcare provider who's been around the block a few times, you know, I really started my career at the intersection of the LGBTQ plus community and the HIV epidemic. I remember going with my wife to San Francisco to visit one of our classmates and seeing a very thriving, energetic community, LGBTQ plus community in San Francisco. And within 2 years, that community was really decimated, had become almost a ghost town in many ways, a very, very immediate flip in culture and character. And this came at the same time that the community was actually experiencing a revolution in awareness in society, and the two things were kind of intertwined. I've not done research in this particular area, but I have many colleagues who have. And fast forward to today, this is an area where there are still active disparities related to gender identification, sexual preference that people experience. And people have to ask themselves when they go to providers, how am I going to be received? How am I going to be treated? And then the outcomes are not necessarily the same either. So this is one of the dynamics that we have to be all aware of as providers, and consciously seek to address on an ongoing basis to make sure that we're being all inclusive, so we don't see the events of say the 1980s repeating themselves.
Thank you. You've watched the whole journey from a pretty early standpoint. Juan, you're both a first generation and low-income college graduate. Can you tell us more about your personal journey and how it has influenced your research and advocacy work in public health?
Yeah, thank you so much, Sylvia. I think for me, being an immigrant, most part, growing up in Mexico from family who depended on farm worker jobs, depended on selling food or things they made with their hands to make a living. It kind of made me reflect on them migrating here as well. And so that family separation of what we endured in Mexico and here, regardless of whatever environment or country you're from, systemic injustices are going to prevail in a lot of these cases based on the systems that exist. And so for me, I didn't know college was something possible. I didn't know that people, quote unquote, like myself, would be able to be in an institution that was not created for us. Like many systems, they were created to exclude certain individuals, especially academia. And that's something we can refer to colonialism from based on the histories that we've had encountered. So as a first generation college student, reflecting on the experiences that my family and I lived in Mexico, but also here in the US, of growing up in the Central Valley and seeing those determinants of health come up at once and over again, of income inequality, racism, homophobia, transphobia, a lot of these systems that control the majority of what is American society, started shaping the way I was approaching my education. And first off, I told myself I want to be a physician. I want to, quote unquote, change the world. But as I started going through the system itself, I realized that there's not much a lot of the times that physicians can do to change things systematically. And so I ended up dropping my biology major and going into ethnic studies. And it was at that point that I started understanding why the conditions exist for the reasons that they do. And it started pushing me to look into research, into public health. And that kind of started gearing me towards where I am now. I will say that after my PhD, I am still interested in engaging in an MD program and a medical degree, because I see the strength of both, or even as a PA. I just think my life took me in a different turn after graduating during the pandemic, where you're low income, you have no connections, you have no way of having financial stability when you're the first one to graduate from an institution. You don't have the connections or the privilege. to be put into situations where you have jobs immediately and things like that. And so for me, the experiences I grew up with, but also seeing my family grow up with inability to access health insurance due to documented status, seeing the way that my family was treated when they would be able to seek status, even at free clinics, they were met with a lot of misogyny or sexism, racism, any of these isms of oppression that you can think of. It's something that we have experienced at some level. And I started seeing it more and more as I went through my education, through faculty, through their implicit biases, through other students who had these preconceived notions of who I was as a person and others in the communities that I am part of. And so that started directing my research to more a structural focus rather than looking at something specific like chronic disease. Everything that we encounter, every outcome is influenced structurally by decision makings at the legal levels, policy levels, and those who are quote unquote in power positions. And so we have to start questioning the root foundation of all these causes, right? And to do that, you need to be uncomfortable and question your own positionality in an institution, in American society, and all these different things in academia in itself, right? A lot of things stem from colonialism, racism, elitism, and you need to be able to have those uncomfortable conversations with yourself to make any change happen. Unless we're just going to keep talking about health injustices and health equity, but not move us anywhere because we're not addressing the root causes of those inequities.
But isn't your experience an invaluable resource for the academic community to learn firsthand what it is and to see what the resources are and are not in the academic environment? So I just think we don't have really enough people in academia to educate the people who haven't had the experiences that you describe.
I think a lot of it starts with acknowledging that we all have different privileges and we've never been have never been put in the position to question who we are or what we have that is tangibly there. Academia is a colonial power that controls what knowledge is produced. And so it starts there of even questioning why we're in academia to begin with, or how we're conducting quote unquote academia, because they control also the way that knowledge is produced and what can be questioned and what cannot. So I think that's a better question, asking why these systems don't allow for this. And you'll find yourself more often than not that it's due to all these systemic issues that we have of racism, classism, colonialism. And so that's, I think, something that I want to call out, that I'm engaging in those systems by being in academia, but I'm trying to do my due diligence of combating that same rhetoric, if that makes sense.
It does. Cynthia, you are co-director of the CDU Kedron Street Medicine Project. Can you tell us about the project's goals? You know, Juan is talking about going into academia and helping to educate the academic community. You're taking the academics' expertise out into the community. So it's a little bit reverse strategy. Is that correct?
You asked me that question earlier about the goals of the street medicine.
Well, but I'm asking about reversing what Juan was talking about. Are you, because you're an academic person as well as a street person with your with your street medicine, and which way does it work best, or do we just have to have both? I mean, is it more important what Juan is saying to educate the academic community, or is it more important to go out and help, as you and Alexandra are doing, you know, in the community?
We have to do both simultaneously. Otherwise, we're just going to be spinning our wheels. And so, you know, I'm privileged and glad that I got the academic, you know, the education. I have, 2 bachelor's degrees and a master's degree, which prepared me to go out into the community. But the needs of the community are so great, Sylvia. And to see that and have experienced that over 40 years, that in lieu of all the the resources that are available, the so-called evidence-based interventions that have been developed through research, to still see the community in the condition that it is in after 40 something years is really sort of heart-wrenching when you look at you know, the major health disparities that still exist in our community in lieu of say the Affordable Care Act, access to care, insurance. And it goes back to what Juan is saying, it's these structural barriers, structural racism, and so that as an academic, if you don't see that, and if you don't confront that, and if you don't try to change that, then there'll be no improvement in the lives of community residents, community constituents, because we have the power. We're making the decisions, we're setting the policies. And so if we don't work based upon the needs of the community to change those policies, there'll be no change, and all of this will be in vain because people will still be dying prematurely when they could have a better quality of life if there was more equity and social justice in the system.
Dr. Carlisle, isn't there a tension though between your goals as the head of an academic institution trying to, train future healthcare providers to be excellent in their knowledge of healthcare and what community need is, and the kind of advocacy that our other three guests are talking about that's needed to really lift up the community? How do you put those two things together and achieve both?
Well, I think they actually can be put together. And, I recognize what Juan Ruiz is speaking to about the contributions of academia sort of in the opposite direction historically. I mean, our academic institutions have defined our society for hundreds and hundreds of years. In fact, they have led our society for hundreds and hundreds of years. The very definition of an ivory tower speaks to the isolation and separation of academia from society, and it goes back hundreds of years. I'm proud to say that, especially at CDU, because of the nature of our founding, we've embraced, I think, all the definitions of community, more or less, as an institution. And so we're an institution where community doesn't just matter, it's part of who we are. And this applies to all communities, including the LGBTQ+ community. I'm very happy to say that. I think that there are institutions in higher education today, as we speak, where this is not the case. They're moving in the wrong direction. I could name some states. There's a state where the postal abbreviation is FL. There's a state where the postal abbreviation is TN. There's a state where the postal abbreviation is TX. That are quite different environments now than we see in California. But we still have our work cut out for us, and there's definitely progress that remains to be achieved even here in California. But California is a better environment than some parts of the country. I'd say that CDU is at the cutting edge of making the California environment a better environment as an academic institution.
Alexandra, what has inspired you to do the work that you're doing in the regard to the issues Dr. Carlisle is describing? What is your background and motivation?
I actually went to school for fashion design and merchandising, and I aspired to be a celebrity stylist. But when, and this was back in 2009, when I went to or was going to school for fashion, and this was only what, like 13, 14 years ago, um, you did not see TGI people in the fashion world. And if you were TGI, you were not even you were pushed out of the fashion world. I know many trans trans women who were who actually went to school for fashion and for beauty and have received higher education in those in the beauty and fashion industry, only to be pushed out or to not be accepted, if you will, by those communities, and so, or by that career community, if you will. So um many of our um many of our TGI community that did go into school, whether it be the arts or beauty, have been pushed out of their career fields and pushed into TGI service provision. Like you will see this on a regular basis. Like for those who graduated from a certain year, that they did not receive at all the level of acceptance that is now available to those who are graduating or who those who are in academia. So to me, I have many years of experience, or of many years, I would say is what it'd be like now, 8 years of higher education under my belt, with not the same level of acceptance. And even if I were to go, and I am going to be going back to school to get my uh, degree, it's not the same. So I think it speaks volumes to when Juan was speaking. We all have our own level of privilege, right? And this is very true, and it comes very real when you have a trans woman um, in a career field, right, in alignment with a cisgender woman. There is no way that the trans woman will ever make the same amount of money that a cisgender woman will ever make. And so um, once you, I think, cross the genders, once you cross that line and then you see it, life in a different way, you start to realize the lines and the boundaries that society has built upon us, they're very clear in the privilege that people have, whether it be the race, whether it be the um, the gender, the identity, all of those things come into play. So um, that is how I've seen it, at least corporatized or in the realm of the um, academia, when it comes to academia, of how it plays out. And so
Are we making progress in your view, or not?
that's a very hard thing to answer. And I'll say this because, are we making progress in the democratic states? Yes, of course. For the people that were born in that state. Are we making progress for the Republican states? No, I don't think so. When you live in a country that says that we are equal, we're more divided than we have ever been as a nation. And when you start to see Republican states create such targeting laws against TGI people, then you start to see the implications that it has on TGI lives. So for me, coming from Washington State, being born and raised in Washington, and then at a moment when I moved to California, California had better protections. So then you start to see a migration of our populations just to seek safety, just to seek employment, because they're not getting any because of the discriminatory laws put in Republican states. So I can't say that we're making progress when another state is making discriminatory laws that affect the lives of our youth, that affect the lives of our community.
Juan, are you aware of such discriminatory laws? Can you describe that a little more?
Yeah, I thank you, Alexandra, for bringing those points up because it's something that I actually am seeing. And so in sociology, they describe this as legal violence. This term that's used is where systems, governments, policymakers specifically create laws that will create violent outcomes and hinder outcomes of individuals. Traditionally, we've used the term legal violence to describe the laws that create difficulties for undocumented folks in the country, because there's specific laws that target identities to lead to worse health outcomes, worse social outcomes, worse outcomes for generations to come. And Alexandra is pinpointing the legislation that are being submitted and approved and signed off on. And so just in 1 year, we've had over 600 plus bills introduced, even in states like California, mind you, that target the TGI community specifically to hinder their well-being, hinder their quote unquote social mobility too. And so what we're seeing is that legal violence is turning the way it functions, where it's not just becoming more overt, hidden form of discrimination. It's flat out just coming out as it is and with harmful intentions. And so that's something we're working right now on, the study that Bambi and Dr. Davis and I are collaborating on, where we're looking at the way that criminalization is influencing the way that transgender Latinas specifically are accessing healthcare services, the way that they're treated. And so this goes beyond just laws. It goes into social criminalization, which is a term that's like used to describe the way that even societies and members of certain communities will target and criminalize TGI people, creating very difficult situations to live in, right? And I have the privilege as a cisgender person to not experience that, right? And so I want to make that clear that as a cisgender person, I also speak from a position of privilege where I'm not constantly thinking about the way someone's going to treat me. In that sense, I think about it in other senses relating to racial or ethnic identity or to sexuality, but it's something that TGI people have to deal with consistently, even to access healthcare services. If folks are not trained in having gender affirming conscious care and caring care, I think it goes beyond just consciousness. It goes into the caring and love for the community. TGI people are going to face the repercussions of those policies, right? Health insurances now in Texas have the ability to deny care to individuals on the basis of quote unquote religious freedom. If they have these hateful rhetorics towards TGI or LGBTQIA plus individuals. And so these practices are being implemented not only in the US, but globally. There's many different case examples. And so when we talk about if we're making progress, I want not to be the bearer of bad news, but we haven't made progress really if you look at it. There's still forms of criminalization and violence that have been transformed, some of them more hidden than obvious. And so I think progress in what sense, right? We have to look at the context, like Alexandra brought up. In some states like California, there's progress, but there's pockets in California where that violence is still happening, like in Temecula Valley and Chino Hills, where they're passing legislation to harm TGI youth. And so I urge to, think about that we might be in a progressive quote unquote state, but there's pockets of these hateful rhetorics everywhere.
Well, Dr. Carlisle, it sounds as though we've moved from a point of acknowledging the diversity within our communities to using instruments of state legislation to oppress people in those communities that we made some progress in identifying and welcoming as part of our circle. So we, in a way, it sounds like we've moved backwards rather than forwards in what we're doing. Is that a fair characterization?
Yeah, I think if anything, it may not be a one size fits all characterization. This is a complex environment, and I agree with Alexandra. I agree with Juan and Professor Davis also. I think one of the things that we're seeing is exactly what's been mentioned here. We've always had this physical violence situation, and within the last 2 weeks, I mean, there have been two, well described episodes of homophobic violence in the United States. One against a Arizona State University professor, another against a older senior citizen in New York City. Both people physically assaulted, ostensibly because of gender identification, sexual orientation. What we're seeing that is actually a significant regression, maybe, is what Juan and Alexandra talked about, which is we're seeing these de jure regressions against our sexual orientation diverse communities occurring in regions in California, yes, Temecula, yes, Chino Hills, regions of the United States, yes, Florida, yes, Tennessee, and regions of the world also. This is a reversal because we weren't seeing as much overt homophobic and gender diverse anti-legislation historically, and it's increasing over time. And I'd say this is a political reality in the United States. And I think people need to be aware. If they're not aware of this, it's actually I'd call it a systemic oppression, quite frankly. And I think it's a reality today. And of course, our goal is to push back against that systemic oppression movement.
Cynthia, do you encounter this as you go out in your van in the Black and brown communities that you're serving? Is this something that comes to your attention as you're bringing services to people who've had no one reaching out to them, trying to make sure that they had access to care? Does this come into your orbit at all, or is this something that our other speakers are identifying in different venues?
I personally say within the last several years, can't say that we have experienced anything like this during our outreach in South LA or LA County. We do serve the LGBTQ community, and if anybody was experiencing any situations like that, they would have brought it to my attention, and I would have, made some effort to, provide support to them and referrals to them and resources to them. But for me personally, I have not experienced that during our outreach with our street medicine program in the last several years.
Probably the people that you have reached in your outreach are people who are just so grateful to have somebody come to them and say, we're here to help. Has that been?
That's very, very true.
Mm-hmm.
Especially working in medically underserved communities, especially in the Black and brown community during the COVID pandemic. It was initially, people were reticent about seeking COVID-related services because of a lot of misinformation from social media, conspiracy theories and what have you. But the more we got out there to educate the community and inform them about the need to get vaccinated, to be protected, the more people sought out our services. And now with the opening of the new medical school, the street medicine program has been integrated into the medical education curriculum of the medical school and the service learning component. And so we've had medical students come out with us in the last month with preceptors at one of our street medicine sites in South LA. And as word has gotten out that medical providers are out doing diagnostic services and interacting with the community, on the days that the medical students and the physicians show up, it's like a long line of people waiting to see the doctor. They're coming in their wheelchairs because we have established a rapport and a relationship and a trust with the community, that especially for people who are uninsured or underinsured, that they know that they can see somebody that looks like them and that's going to provide services to them in a culturally appropriate way. And they feel that, they deserve to have these type of services. So that's been really rewarding in the last month to see the community response to our students being out in the community to provide these services to the community.
It's probably also lovely to see people who are young coming to help.
Mm-hmm.
Young people connect in a different way than people who are just older and more experienced. Alexandra, can you talk about Latin immigrants and as part of your research focus? What are you looking at? What are you learning that you can help us be more vigilant about going forward?
Thank you for that question. I think one of the things that COVID taught us is how we can come united, but also how divided we are as communities and as people experiencing need. One of the things that we saw was that when it came to COVID, and now it seems like, for example, how COVID and HIV and other health disparities are affecting the Latina community, and how the rate of infection is spreading across the board for all of them. Monkeypox was a really big one, a really big indicator of how it first was focused on white cisgender gay men, and then the reality came that the most impacted were cisgender men of color. And so that is how one can measure and one can very easily see within just going to the county or the public the Department of Public Services, like or the government websites on how treatment is measured, right? And so if you really went in and started to see monkeypox alone, which is the simpler or the smaller numbers, you started to see how treatment was offered and when treatment was given to the different ethnicities in the men, or who, because the majority were men, the men who had gotten monkeypox, the level of access to treatment to the Latina community was significantly lower. And when you raise these questions to the health department, they say, well, at least we got people treatment, or at least we got people services, or at least we tried. And then that raises another question. Why the defense? Why does this person have to respond with a defense? The question was not the question that was asked, and that was not the way that it was asked. The question was, why are communities that are getting infected at higher rates not being provided with treatment options at the same rate that their white counterparts? That is the question. And that would require an answer. And that would require that the government be held accountable for the service provision of these communities, when in reality, you know that that's not the case, because one, of language, two, messaging, three, marketing, like so many different aspects come into play. But then that asks the larger question, well, why not, right? If you know as a health department that there is disparities within certain communities, why wouldn't you make sure that those communities have an equitable standpoint when it comes to staffing to be able to cover marketing, language, and media, or any of these things? And so those are the things that I often see missing, right? And I am not in academia, and I'm not in research, and I'm not highly educated. But if I can see these things as a TGI person in the communities in which I represent, and if I can see this, like, I don't understand what all of these people that do have an academic background are doing. And are we frankly doing our jobs at the end of the day? And so that is the one thing that I continue to ask, like, frankly speaking, if I am not in academia, and I am not a person that has a degree, and I can highlight the um, most uncomfortable truths of what is happening within our nation, and within service provision, and within health disparities, and if I can read the graphs, like, why is this happening?
But Juan,
So
is it that they can read the graphs, but they don't care to respond to it? Or is it that they don't read the graphs?
I mean, they were reading the graphs when they were doing the presentation. I mean, this is the health department, right? And so they were the ones presenting this information. I was not presenting this information. They were presenting it to us as community stakeholders.
So
And
the
that's
que-
where our policy component comes in. As a TransLatin coalition, we know that the government will not hold themselves accountable to the laws that are in place that create barriers and systems of oppression to the communities that represent them. We know that the government will not do that. So we, the TransLatin coalition, have set that approach and a policy platform that we will hold our elected officials, our policymakers, our leaders in this nation, in this state, in this county, be held accountable to make sure that TGI people don't continue to face the health disparities that they continue to face on a daily basis.
Do we have the numbers, Juan, to do that? Do we have organized groups who can present these issues and say, why aren't you responding to the data? And
I think first off, before I answer that, I'm gonna call it out like how it is in the systems. A lot of the time, many academics do not view the community as experts. In reality, we're elitists for that perspective, like Alexandra is mentioning. We believe that because we have a title and a piece of paper that says you're an expert in XY field, you know everything. And that's, I think, something that we need to address, the classist thinking that academia presents. These academics know the disparities that exist if they can see it on the graphs, but they just don't care. I want to call that out, especially when those communities are marginalized communities that I have no love or care for. We're going to have these types of responses, right? And it's not just with the TGI community. If you look at intersections, if you have someone in the LGBTQIA plus community who's white or cisgender, the response will be extremely different because there's a protective factor of whiteness. And so it goes into these intersections where I will even go as far as saying that the true experts are the community members impacted by the issues, not us. And so the power is already there. Communities and community organizers are doing the work. I think where the lack of care exists or the lack of initiative is on the government officials who have the power to make legislative decisions. And I'm willing to back that up because there's history of that. It's not just historical anymore, it's contemporary. It's happening now, as Alexandra is mentioning. There's folks in power who don't have care or have interest in supporting the communities that are most marginalized, because that's exactly what the system was intended to do when it was created. And so the numbers are there, the organization is there, the community advocacy is there, the outrage of the community is there. What's not there is those making those decisions having care and interest and frankly the willingness to acknowledge that they don't know everything, and being able to say, you know what, we don't know what we're doing, or frankly, a lot of them might even say we don't care, which is the unfortunate nature. So I would even go as far as challenging us in that way, that the best experts are the community enduring the conditions that they're enduring. We might have a degree or have a piece of paper that says X, Y, and Z, but I would even say, Alexandra, you're more educated than anything on the issues you're discussing because you've experienced them. The community has shared them with you. There's some resonance there with lived experience. It's like myself too. Numbers can only get us so far, and those numbers are there, but the people in those positions of power have to be willing to make those decisions. So I don't think it's on the community anymore. The community does enough to get these issues out there. It's time to flip that rhetoric and say those in power don't have the expertise because they're not living those realities. But that would be my 2 cents to that type of conversation as a marginalized person.
Dr. Carlisle, can an institution like CDU be a bridge to other institutions in this regard? Can we partner with the community experts to say this is an elected area of work and focus and representation? I mean, it seems to me, being a minority focused institution, you know, we have Cynthia, who's been working for years and years in the community. Are we taking these issues that have been described so powerfully today to other academic institutions to say, can we all work together on this to enlarge the circumference of what we're doing for minority communities?
Well, it's a really interesting question, Sylvia. I would say that CDU is not here so much for that purpose as the purpose as it is to empower the communities that we serve. That might be a more acute or immediate priority than trying to rebuild the ivory towers. I'm thinking of what happens or what's happening with a new university in Florida, where they're basically fighting their whole reason for existence in the context of the political situation in Florida. That's a school that is challenged right now because students are voting with their feet, faculty members are voting with their feet, and they're saying, we don't want to be part of a oppressive system in higher education. I'm thinking of a broader role of academia, and we tend to think of academia as this kind of cloistered, elitist environment. True, that's pretty much what it is in many ways, but there are other perspectives. And there's 50 years ago, somebody named Paulo Freire published a book that if people are interested in this topic, they might want to look it up. It's called Pedagogy of the Oppressed. Paulo Freire was a Brazilian academic, and he basically challenged the very tenets of higher education, and basically was an advocate for not just bringing education to the people, because that is an elitist concept in and of itself, but utilizing the people for the purpose of their own education and enlightenment. And this is another perspective on education that has existed historically for decades, that we don't see addressed very much presently. But the history is there, the precedents are there. Paulo Freire from Brazil.
Well, this conversation, unfortunately, needs to be brought to a close, but there's so much more, Alexandra and Juan, that we can learn from you and from Cynthia about what you've learned in the community, what's there that we're not addressing, what needs to be addressed more deeply. But I want to thank each of you for being here and exploring a very complicated set of issues, dramatically impacting people of color in poor communities, not adequately addressed. But I'm encouraged by the leadership that we've experienced and heard about today, because I think wonderful people are making efforts in that regard. So thank you. Thank you for what you all are doing, and thank you for sharing it with our audience today. And we look forward to seeing you at future encounters. So let's not have this be the last time we have this conversation. Okay?
Thank you, Sylvia.
Thanks very much.
Bye-bye.
Have a good evening, everybody.
Thank you.